Good morning, it's Christine. I want to discuss more about the worry of the second wave of this COVID pandemic. And um, if you look at the news right now, there's still pandemic still spreading, and people are still dying, and people are still infected, and it's like after the whole world left literally left the wave one and opens all these restaurants and let people sit down in the restaurants and let children goes back to school and all these things, and you think it's safe out there. I don't think so. So I actually compiled some videos that I found on media that I could actually help you get educated a little bit about the idea of coronavirus wave 2. So listen to this one.
I think that it's quite possible that over the next 5 to 10 years, about 50% of our people could be working remotely.
For us, the obvious choice was to really strongly encourage our employees to work from home. Over the course of the last really couple of years, we have been moving to a more distributed workforce.
I believe that talent and intelligence are equally distributed throughout the world, but opportunity is not. In Silicon Valley, you have the big tech companies fishing from essentially the same small pond or bay. By making the company distributed, we can fish from the entire ocean.
If most of us are working remotely at this point, it doesn't make sense for us to be constraining all of our hiring to people who happen to live near offices that a lot of people aren't going to be able to go into anyway.
Cost savings has never been a driver for us to distribute our workforce. If you reduce food service, for example, because not as many people are coming into the office, what I think that'll allow us to do is shift resources to allowing more support for people in their home office setup, where you might save costs from an office perspective. I think if you're going to do it the right way, you've got to reinvest in other things.
One of the things that can facilitate depression is social isolation or loneliness. In some cases, you will have people that will be living alone. So the unfortunate nature of what we're being told to do is not great for the brain and for keeping the brain healthy. So I would be concerned that at the moment that we might see the rate of depression rise.
Products can sometimes get built in a matter of months, but culture is built day by day over years and decades. And I think it's really important to take a long-term approach to how we think about remote work, because this is fundamentally about changing our culture and the way that we all are going to work long.
Okay, so I want you to listen to this one news from this guy here and hear what he says.
Coronavirus restrictions rapidly easing and winter now here. We're warned that there could be a renewed growth in infections in Australia. It will be some time before we see if there are any signs of a second wave, but at least one country is already experiencing one. Here's our analyst Casey Briggs.
We haven't seen many countries yet experiencing a second wave through this pandemic, but one example of a country in that position does appear to be Iran. Iran has 157,000 confirmed cases now in total. It was badly hit by this virus very early in the pandemic. in February and imposed tough restrictions that it's since eased. And since then, we've seen a steady increase after some progress in the case curve. Now around 2,500, 3,000 cases every day confirmed in Iran. And that's pretty similar to the peaks that we were seeing in that country in March of 3,000. So cases are increasing in Iran. It certainly looks like a second wave of infection. Cases are actually rising across the entire world. If you look at all of the globe's cases as one, 6.3 million, and we've seen a bit of an upward trend in the last 3 or 4 weeks. We're now seeing more than 100,000, up to 120,000 cases confirmed every day. Another region where cases are increasing, bucking the trend of some of the more high-profile outbreaks where cases have been on the decline. Another region where they're increasing, though, is Africa. Now, Africa has been of concern for some time. We haven't seen the sort of growth that we maybe feared early on, that this would spiral out of control very quickly. Why could that be? Well, potentially there's less volumes of travel across the African continent than you've seen in Europe, so less chance for the virus to move around quickly. Maybe the climate's had an impact as well, but regardless, the curve is still increasing and Africa is still facing potentially quite a bad situation. 6,000 cases every day across the continent. Some countries, of course, hit worse than others. And there are other health challenges there as well. Countries like the Congo, where cases are still increasing, the curve is growing, and Congo is now dealing with another outbreak, a declaration of an Ebola outbreak, and that's not going to make handling this pandemic any easier.
So let's see how much it will affect our public or community in our country when it comes to coronavirus. And at this point, it didn't stop spreading, but it continues on, and how long it's going to take, we don't know. So listen to this one.
Headlines about mounting death tolls and disease, fake news and political battles, people losing their jobs, economic recessions hitting across the world, people stuck indoors, and people facing it on the front lines.
We cannot take it anymore.
It's a depressing combination, of course, and the United Nations is asking governments that as the pandemic crisis drags on, not to forget about the mental health toll that this is having on many, many people. It needs to be front and center in the response, they say. Deborah Kestel is the director of the World Health Organization unit that deals with mental health, drug, and alcohol abuse.
We have seen in the past that similar cases of economic crisis have increased the number of people with mental health issues, leading to high rates of suicide, for example, due to the mental health condition or the substance abuse, for example. Some surveys that were done in Canada, where 47% of healthcare workers reported need for psychological support, 47%, almost half of them. In China, we have different figures for depression, 50%, anxiety, 45%, insomnia, 34%. The numbers are there, and these are just preliminary, we know.
The WHO's report released on Thursday also shows high levels of distress in the United States' general population, about 45% of those surveyed. Children and frontline workers, they say, are among the most vulnerable groups. Reuters has itself met many doctors and nurses across the world experiencing combinations of panic, grief, nightmares. The WHO did outline steps that governments can take to help ease this burden, including addressing past underfunding of psychological services and pushing online resources such as video conferences with therapists.
Okay, so I just don't get it why the world leader basically released businesses already in the country, and it's a main worry because when I heard that the world leaders is lifting wave 1 coronavirus, it's not a good thing at all, because we're gonna spread more viruses this way. And so I thought you're just welcoming wave 2 and spreading more virus everywhere and kill more people. And at this point, people already suffering dealing with this. And now World Health Organization is even talking about people can commit suicides, and already some people did. So I don't know how governments in the entire world decide to just lift it right away without dealing with this properly, or making sure that it's zeroed first before you lift everything. We need a good explanation to that. And so I don't hear from any leaders of any countries why you have to lift wave 1 and open businesses and schools and just continue on with the day of just opening businesses this way, where we know that it's not safe for the people. So that is just my worry and my frustration at the same time, why a world leader will decide to just do it this way without considering that it's not fixing the issue at all. So I need an explanation to this. So at least one of you can speak up and explain how you guys work it. Wave 1 is not done. Wave 2 is coming up. Is it like it's going to be a cycle of wave until everybody in this entire world is gone? And what is the intention behind this? Please do explain who is the main people who is making the decision on how to lift the wave and welcome wave 2. Okay? Anyway, talk to you later. Have a great day.